taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenoir and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well.
And then I'm going to take you off. All right, welcome to today's edition of the Wellness Watch. I'm your host, Dr. Mike Lenoir. A very special program for us today. One of my very dearest friends, a very knowledgeable man who has had an opportunity to deal with prostate cancer in a very different way, Mr. Robert Christmas. Mr. Christmas lives in the Bay Area, and he has had prostate cancer in a way that many of you may not experience. So, Mr. Christmas, hey, welcome to our program. I've been trying to get you for a long time. Tell us a little bit about yourself, especially about your hospital experiences.
Certainly. Thank you, Dr. Lenoir. It's an honor to be here. I started working in hospitals as a very young man, Mercy Hospital in Chicago, and it was because of my mom working there as a nurse, and her grandfather, my great-grandfather, was a physician in this hospital. And so all of my life, I've been exposed to healthcare. And I think that has helped me address the disease that I'm working with now. But as I said, I saw patients, I would do work on patients as a medical technologist, and I always appreciated how important it was to understanding patients. I became a special surveyor with the Joint Commission. So I used to inspect hospitals all over the world. And because of my health background, I was very sensitive about doing the necessary screening that all of us are encouraged to do. And I would have a PSA regularly every year, and I would get the results back, and they were normal, as well as other things, glucose.
Let me ask you,
Yes.
you run some of the biggest hospitals in the country, in the Harlem Hospital and other things.
Mm-hmm.
And I never will forget the day you called me and said that your PSA was high. And, you know, that kind of stunned me a little bit. And you told me what the number was, and it was significant. How did you respond to my response to your PSA? For those of you who don't know, for those of you who don't know, PSA is the prostate-specific antigen that all of you should get, Black males should get, in order to define your level, if any, of prostate cancer. But tell me, what was your first feeling?
Well, man, I was just getting ready to get to that, Dr. Lenoir. And again, so I would do all the things that you do, get my eyes checked and what have you. And so I got the PSA and, I was doing PSAs. And for some reason, and I don't know the reason, I stopped doing PSAs in COVID. So late 2019 and going into 2020. And in 23, I said, gee, I ought to start doing this again. And I was asymptomatic, except for excess urination. And I got the PSA, and it was at a panic level high. And I panicked. I literally panicked. I was in shock. And I'm telling everyone who's listening to this, the first thing I did, and I never thought about anything other than that, is calling Dr. Michael Lenoir for two reasons. One is Michael is a dear friend, and Michael is an esteemed clinician. So I knew I would get empathy from him, sympathy and empathy from him because of the results. But as a friend, I knew that he would provide comforting words for me.
One of the problems so often in situations like this is that the doctor is insensitive to the kind of way you respond to a major medical issue. And I think the fact that you are certainly very receptive and you are a friend of mine, obviously we try to dialogue at kind of a different level, but not a level that other people shouldn't have with their physicians when they get a diagnosis like that. What were your first questions to ask medically to yourself, to me, and to your first urologist?
Well, my first question, and before I talk to any other clinician other than you, my first question was, oh my God, is this okay? I mean, the numbers were high, but is this, oh gee, they said, this normally happen. So what you did, and this was comforting, and I think it's a direct response to the question you just asked. The first thing you said to me, first of all, before we do anything, we're going to validate the results. So he says, I want you to get another PSA. Sometimes there could be, an error and what have you. And you said that, let's get that first. The second thing you said to me is, I'm going to introduce you to a young urologist, and I think you'll find that he's going to be very helpful to you. And the third thing you said to me, which was the most comforting, you said, don't worry, we're going to get through this. And when you said we're going to get through this, you immediately made me feel I have a partner in this. So my initial feeling was absolute shock, and I didn't even know what to do. And when I called you, because I called you within 5 minutes of that, you comforted me. And you gave me some suggestions about what to do, as I said earlier. So that was the initial. And because I used to be a lab technician, I know what critical results are. And I know, and I said, oh no, this is way out of the a range of a normality for this particular thing.
So tell me about the process that you went through after that to get to kind of a final conclusion as to where you were clinically.
Certainly. I contacted this physician, and his name is Dawood Langford, African-American physician that Michael introduced me to. And I went to his office, and the first thing, of course, he said, I've talked to Dr. Lenoir. I know a little bit about you, but please tell me about you. And he listened very intently as I told him my background in healthcare and what have you. And so he said, okay, so let's do this. He said, let's find out more about you. So he ordered tests on me. I had, when I say tests, screening tests for diagnosis. So I had an MRI, I had a PET CT, I had, we did biopsies, and all of the time that he was ordering these tests and I was getting them done, I was kind of really in a cloud because I didn't know the results, but I said, gee, I've seen other patients go through this. Now I know what it's like. So we went through a series of those. He got all of the tests together and called me in his office. He had a whiteboard and he pointed out, well, this test indicates this test indicates that, and so on and so forth. It was very nice. And then he concluded, he said, Robert, you have metastatic prostate cancer and widespread metastases, stage 5. And I almost passed out. I was with my wife, and she was sitting next to me, and I almost passed out. I didn't know. But he quickly said, okay, now what we're going to do is manage this. So he said, we got a series of things, there's different tests that are done. There's different approaches to this. It's not like it was years ago where this was a death nail. And it's a cancer that can be managed. So he says, so the first thing we're going to do is introduce you to a physician at Stanford that specializes in metastatic prostate cancer, Ali Kaki.
One of the things before we move forward, is most people may not know the term metastatic. The metastatic means that the cancer, prostate cancer, had already spread.
Yes.
Several organ systems in the body, maybe even to the bone and other places. And the reason that's so important, Robert, is that a lot of people, when they get something like that, feel this is like a death sentence. But we know now, and I knew then, that even if you have metastatic prostate cancer, that it's not a death sentence. So continue your story. I just wanted to explain. Explain that to our
No, thank you. And again, this was, first of all, having the PSA, which I've done many times, as I said, and getting these results, I was in shock. And I was in shock thinking back retrospectively because I was asymptomatic. Besides increased urination, which I said a lot of African American men are, as they get older, that was my only symptom. I didn't have aches and pains and so then I start studying, and I know, and metastatic means like it's spread. And I made a big mistake when I had one of those tests that I just talked about. And it was a full body scan, and the results came back, and the results the heading was widespread metastases. Those were the two words. And of course, each one I looked at, and I literally was in panic, and I didn't realize that there is options. Then I met Dr. Langford and Dr. Kaki, and they sat with me, and they said together, we're going to handle this. And there's two things that are very important, Robert, and that's quality of life and you taking care of yourself. And I said, okay, that's good. I understand that. So because it was a cancer, they said, we're going to address this cancer with a treatment pharmaceutically. And so I had abiraterone. I was taking that and with prednisone. And I remember after a couple months of that, we did the PSA, and it was 151, and it got down to 11. And a month later, continued taking this medication. It got to undetectable. And of course, I went from being shocked about it and then being shocked that at least it's in a manageable area now. And so I continued. Yes.
Yeah, now, what have your doctors told you about the plan for you moving forward? Obviously, many of the men who are looking at our program don't have access to kind of the latest treatment like you get at a Stanford University. What have they told you about, how you're going to deal with this and what the prognosis looks like?
Very good question. And again, as some of you who are in the audience may know, when you go into a doctor's office or any kind of healthcare provider's office, they tell you a lot of things. And some of the things were a little shocking. And so all the time this was happening, my wife accompanied me, and she took copious notes. And we would come back home, and then we would compare to her understanding of what was stated and my understanding. And that was so helpful because she heard things differently than I did as a patient. But both of the physicians that I was fortunate to see kept telling me, and I'm going to quote Kaki, he says, look, nobody wants to have cancer, nobody. But if you have cancer, that is one a disease entity that we can manage, and we can manage more than any other type. And again, he said manage, he used the word manage, and he used the word quality of life. Because I'm in healthcare, I'm sorry, go ahead.
No, keep asking.
No, because I'm in healthcare, I know how important it was that I became a very compliant patient. Okay, and I was. Everything they told me to do, I did.
What kind of impact is it having on your daily life? Because I think a lot of men are going to be very surprised by the fact that even with metastatic prostate cancer, there are ways to manage it. But what's your daily life like? Is there a lot of pain involved? Are there other things involved? What are some of the side effects of your treatments?
Another great question. Well, one of the things that I didn't say that it was discussed with me, the pharmaceutical approach has some side effects. And one of the side effects of what we were doing, it reduced testosterone. And they told me that's the key. We're going to reduce testosterone because the cancer likes to feed off of testosterone. So we're going to starve the cancer by reducing your testosterone. And I said, okay, fine. I'm taking the medication. Now there's some side effects with taking the testosterone in terms of I felt more fatigue than I did. And I don't know if it was psychosomatic, because I said, gee, you got cancer, man. And every little feeling I had, it was, oh man, that's cancer. And it spread. It's gone through your whole body, and that's you. It's cancer. It's cancer. So I had to work through that because, as you know, I have a full 9-station gym in my house, and I worked out every day. And then I became scared to work out. I said, man, don't do that. You're going to hurt yourself and what have you. So I had to make that adjustment. And then the last adjustment was the issue of not having testosterone. It's going to affect my libido. And
let me ask you, while we're on this particular subject,
yeah,
what has been the hardest thing for you to deal with? I mean, in terms of activities and quality of life, since you made this diagnosis.
Fatigue. And one of the things, just little things. I think we all get a little tired, but I felt really fatigued, and I would sleep a lot. Now, meanwhile, 2023 is when this was diagnosed. I had a full-time job. So I was traveling, and I think the traveling, the challenge of traveling helped me take my mind off my body. And I worried about getting places. And I said, I inspected hospitals all over the world. And I kept doing that. And I felt fatigued. And of course, being in healthcare, I was around clinicians all the time, and I would share with them my situation, asking them to watch me. Do I do anything different? So all those types of things, I invited individuals into my life to look at my life and kind of see, Robert, are you any different? Are you doing anything different now? And so that was new for me.
Well, I know one of the things that makes it, and that impacted, we were golf buddies.
Yep.
And we were playing hard golf for a long time. I'm not going to let you get away with the fact that you have metastatic prostate cancer.
I know.
I'm not giving you any strokes. I'm not doing any of those things. And I think that may have been one of the hardest things because we were both so involved in it.
Well, it was hard, but I'm glad the audience was. As I said, I'm very blessed to have Michael as a dear personal friend. And if Michael would have said, hey, man, I'm going to give you some strokes, I'm going to do this, that would have made me feel worse.
No, I'm not.
Because, and so I said, well, now I'm handicapped. So Michael, and he never did that. He got even crueler to me.
I wanted the money.
Yeah, and so that's it. But that made me feel more normal. That's the point. Michael wouldn't let me feel sickly.
I'm never going to give you strokes.
No, that's it. Never. No.
How are you doing emotionally right now?
Well, I had during this time, and it actually started before, I had an arthritic knee, and so it was getting worse, and so I had knee surgery, and my oncologist agreed it's no problem at all, and it went well, and and actually my 1-year anniversary, I had the surgery March the 10th of last year, so it's 1-year anniversary, so I feel much better. That was bothering me, aches and pains and this. And so I feel as positive as I felt in a long, long time because I'm dealing with this. It seems to me that the approach that we're taking, pharmaceutical approach, is very good. And I'll say one other thing. I asked them, I said, hey, what about some clinical trials? Would I be a candidate for clinical trials? And their response was, no, what we're doing is working. The pharmaceutical approach is working. So we don't need to talk about any kind of clinical trials. And so the only thing I've done besides the pharmaceutical, and I started this in October of last year, I did immunotherapy, where they would draw blood from me, take out certain cells, white cells for sure, and then they would mix that with cancer fighting cells and infuse it back into me. And I had 6 treatments of those, basically the whole month of October. And so that has also made me feel I ain't just sitting around feeling why me. I'm doing something. I'm doing what my doctors are telling me to do, and what my friends are telling me to do.
We're talking with Mr. Robert Christmas. Mr. Christmas is an experienced healthcare executive who, during his lifelong journey, found out he had metastatic prostate cancer. He has subsequently gotten adequate treatment. He's in a different place now. And now we're going to deal with a little bit more of the kinds of things that many of you might ask. Well, what's important to you now that wasn't important to you then?
Oh, gee, I think appreciation, gratitude. Gratitude, I've been healthy all my life, so I never felt that feeling, oh, why me? What have I done? I'm a good person. Why are you letting this happen to me, God? And I think that helped, that I've been in healthcare all my life, and I've seen people that are so sick they're just trying to get through the day. So I think that perspective helped me. But the thing that's helped me, and I'm not saying this because Michael's on the phone, but to having a friend like Michael who I can talk to, and he won't give me any strokes. He already said that. So I don't talk to him about golf, but I talk to him about what a wonderful positive aspect I have in my life to have friends like him. That has helped me think positively. And so, yeah, that's just, yeah, I'm blessed. Hello, are you there? Are we gone? No. Michael, are you there?
Yeah. What is your goal now that you're moving forward? Obviously, what is the role of the spouse in a situation like this?
Excellent question. Steffi and I have been together for 30 years. And we met in 1994. And of course, she is in healthcare herself. But her role to me has been an absolute partner. I've noted in her style, she listens a lot more than she used to. She writes notes. She asked me so much so I said, quit asking me. She asked me 10 times a day, how do you feel? How do you feel? I said, quit asking me that. I don't, And so I feel that she's asking in a sense of loving and curiosity, and I'm loving because she can tell if I'm deviating. And so in that sense, the part that you mentioned before, Michael, and that is the libido that I mentioned, we've talked about that. And fortunately for us in our lives, that has not been an issue at all. And I'm sure if that ever was an issue with a couple, that could be very difficult for both, but particularly the person who has health challenges. But we don't have any of that. She cooks every day, and she never cooked before that, but she makes food. She makes smoothies. She makes it's called sour sop for those of you who are on SOURSOP. It's a plant. So she mixes the plant and makes sour sop tea for me. So in that sense, my partner is a real partner in this. And that she told me, she says, when you were diagnosed, I was diagnosed, Robert. And so this is both of our health challenge to deal with. So I can just say to you, who's ever on this call, that was much better and much more effective than any other medication or any other approach that I have is her. No question about that. No question.
Robert, you're very good about summarizing things and talking to people about health. What do you want people to get out of this interview?
That we're all subject to health challenges in our lives, and some of them, as Dr. Lenoir has shared with us over the years, some African American men are more prone to some than others, and African American women. more prone than others. And it's not that God is punishing me, and it's a challenge. I like challenges, and it's something that I have to deal with. I've never, ever in my life been talking about as much as I do now about end of life. You know, this approach is going to help you live. I read something today that approach is going to help you live 6 months longer, and it startled me. 6 months longer, and so I hear those kinds of things now, and I think about that. I feel, as I said, I feel that I'll say one quick thing. When I first got the results of the results of the PSA, I talked to Michael Lenoir, and then I thought, I'm going to get a Lamborghini. And I know that sounds silly and sounds very shallow. I don't know why, but I said, shit, I'm not going to live long. I'll be here another 2 weeks. I'm going to get me a Lamborghini to drive. And that's the first thought that came in my mind. And of course, it left. But I was in shock. I was just in shock.
Well, I think that the important thing is for people to understand that, A, you need to get your PSA. If you're a Black man,
Yes.
you need to understand it. You need to select the right healthcare system to help you deal with it. Very important that you get your biopsies on an MRI rather than a blind biopsy. That even in this, and I don't think you mind me saying this, your PSA was as high as any I've seen in my career. And yet here we are, 2.5 years later, we're still talking,
Yep.
we're still walking, and I'm still waiting to get that money from you.
I know
that
that's
goes.
it.
Yeah, so
That's the thing that bothers me the most is I have these debts hanging over me from Dr. Lenoir on the golf course.
And I want Black men to understand that no matter what your PSA is, nowadays, a PSA is not a death sentence. And you need to find the right doctor, get the right information. And if you can't do that, go to our website at alwellnessproject.org. Mr. Christmas, thank you for allowing
Can I say one last thing?
You can say more than one.
Oh, well, I'll say this. One of the things that I think is important, not just because of my diagnosis, but just important anyway, think of positive things that you can do. Don't sit around in the dark, which I did initially. And I just, I would look and and I think, and some people say, what do you want to do? And I told him, I said, there's 2 things that I'm looking forward to doing. And that's playing more golf with Mike Lenoir, and I'm going to get a puppy. And why? A puppy's going to make me do things. It's going to make me take him for a walk. It's going to make me focus on helping something else. And I'm doing that. I love dogs anyway, but I'm doing that psychologically because I think it's going to help me maintain a healthy approach.
All right. Well, I want to thank Mr. Christmas for joining us. I want the audience to understand that he's sharing his story, not because he's that kind of person. He's a very private person, but because he thinks his example will have some impact on you. And if you get your PSA and you have a problem, or even if you have any kind of a chronic medical challenge, I think it's very important for you to understand that your attitude toward that challenge makes a big difference. You need to be intelligent. You need to look for solutions. You need to make suggestions, and you need to keep yourself up emotionally and those around you. So as we always say at the end of the African American Wellness Project's Wellness Watch, because health is your biggest asset, so protect it.